Today on Medical Montana, I'm in Havre. I'm at the Bullhook Community Health Center. I've just met a new friend, Patti Alderson. Patti, it's good to meet you.
Nice to meet you.
You are a nurse practitioner here at the health center. And for the sake of our audience, would you tell us a little bit about what that means?
I provide medical care to patients of all ages. I can see the infant all the way to the elderly. I do preventative care as well as chronic care management for these patients.
Now, are you the step right before they meet the doctor, or are you in place of?
I'm actually in place of the doctor.
So what does a typical day look like for Patti here at the health center?
It varies from day to day, which is why I love my job. I can, I might do a well child check in the morning, have a few school physicals, then see someone for management of their hypertension or diabetes or any of those conditions.
Tell me about, because we spoke earlier about the medication part of your responsibility. Let's talk about that.
So we're in the process of offering what we call medication-assisted treatment, which is treatment for opioid addiction with a combination of medication and behavioral therapy. We actually have a provider here who's been doing some form of that for quite some time now with the naltrexone, but I just recently completed my data waiver training so that I can offer buprenorphine as well.
I know that the opioid addiction is just a big issue all across the country right now. Are you seeing issues right here in Havre?
Oh, we have a very high opioid dependence population here at the moment.
And you say it's been this way for some time.
For most of the time that I've lived here, which has been almost 7 years, we've had some problems, yes.
And how much of your day would you say is taken up by that?
It varies. Sometimes it can be almost all of my patients. Sometimes I can go days without seeing any. It just depends on the schedule. There's no set amount.
Well, great. Well, I'm sure the Community Health Center is pleased to have you aboard. Thanks for spending time with us today.
Thank you.